Today we're going to do something a little bit different for you guys. I've invited two distinguished gentlemen here to basically have a conversation. I'm going to kind of try to stay out of the way as much as possible. It might not be completely possible, but I'm going to do my best and let these two gentlemen talk. We're going to cover a topic around Pulse PEMF and how it's used and applied in the practice of Dr. Jeremy Schmoe, one of our guests. He's from the Functional Neurology Center in the Minneapolis area, basically, and he is a functional neurology specialist, a chiropractor, been practicing for several years, couple of decades. And Dr. Palmer is based in Scottsdale, Arizona. He's also a chiropractor, and he happens to be the executive director for an organization called the Pro Hockey Chiropractic Society, or PHCS, where I will be doing an event later this month up in the Bloomington, Minnesota area. And so anyone who watches this ahead of that event happening is welcome to attend that, and we'll include information on how you register for that and things like that. But we just wanted to have a conversation around how Pulse is being used at Dr. Schmoe's practice, and hopefully cover some ground in terms of what the audience might be wanting to learn on this topic. And so, Doc Allen, I'm going to hand things over to you, and why don't you kick us off if you can?
All right, I'll do my best. Yeah. So it's nice to see you, Joe, and nice to meet you, Doc.
Yeah, nice to meet you as well.
Ever since I became acquainted with you this past week, I've been really, diving into a little bit more about what you do in your center and everything like that. And I am just thoroughly impressed with your background and your education, your knowledge, and some of the innovative things that you're doing in your practice, which is really exciting. And someone as myself, I've worked with two professional teams here in Arizona for over 20 years, and then founded the Professional Baseball Chiropractic Society, co-founded that, and then founded the Professional Hockey one. We've had a lot of great speakers over the years. I've met a lot of really cool docs that are really some of the top at what they do, in their particular disciplines. And I have to say that, your credentials and everything have really blown me out of the water. I'm just very, very impressed by that. So I'm looking forward to this conversation.
I appreciate it. Yeah.
Definitely looking forward to this conversation. Yeah, so, let's just start off by, asking you, tell me a little bit about your practice and the type of patients and athletes that you work with in your practice.
So, how I got into this stuff was got very interested in overall like electromedicine when I was in high school. So the developer and CEO of ARP Wave lived down the street from my grandma and grandpa. So Dennis Thompson, I don't know if you guys know who he is, but I was friends with his son, Colt Thompson, who's now the CEO of ARP Wave. So I was always interested in, electrical medicine and how it can heal the body and heal up tissue. So originally, I got into this from more of like a sports standpoint. And I thought that I was going to be doing everything with injuries and athletics. And then I got very interested in TBI and concussion. I started doing all the work with Professor Carrick at the Carrick Institute and taking all those courses, and just met some, really amazing people that were doing work with movement disorders and post-stroke rehabilitation, traumatic brain injury, dizziness and vertigo. And that's kind of how I went down the whole neurological route. So Dennis Thompson was working with a chiropractor. His name is Dr. John Pietzola, and he was using ARP Wave, and he was also taking all the functional neurology courses. So that's how I got introduced to functional neurology. And then, basically my practice has morphed into, mostly traumatic brain injury. So for about a decade, doing a lot of traumatic brain injury, concussion, dizziness, and vertigo. And then it kind of like looped back around where I started seeing all these athletes, probably about 2016, 2017, it was mostly hockey players, being where we're at in Minnetonka here. A lot of the professional players live within, 10, 15 minutes of where we're at with our clinic. So I started working with, these guys are okay if I say their names, but like Mark Parrish, got him a lot better. Dan Sexton, he was a local guy that played for Anaheim and also played in the KHL. And then I started working on a lot of KHL players actually first before NHL. But everybody was coming to see me mostly for TBI symptoms. So they had hits, dizziness, vertigo, that type of thing. And then I started adding in more technologies to overall help with chronic pain, sleep, overall fatigue. And that's where I got introduced to PEMF from JVR, who was playing for the Flyers. So he had a PEMF device, and that's where I had first really, heard about PEMF. I knew about it, but I didn't really know exactly what it could do. And I bought a Pulse PEMF after being at the ISCN conference, Joe. I think that's where I met you.
Yep.
And I went on it myself, and I had a shoulder issue that was going on at that time. It just made significant improvements in my shoulder pain. So I'm like, okay, I gotta get the Pulse PEMF. So I got the Pulse PEMF and started using it on everybody in our practice, ranging from patients with dysautonomia, patients with peripheral neuropathy, chronic pain, cervical spine whiplash. So there's so many uses that you can use Pulse for, and we'll kind of get into that. But that's basically the history. Started off with, ARP wave, moving into Pulse PEMF, and also incorporating a lot of other therapies as well, like low-level laser, lots of other modalities. But there's so many different ways that you can use Pulse, and we can get into that.
Yeah, you were just explaining some of those, different problems that you were solving with that therapy, that unique modality that traditional chiropractic and rehab approaches don't really address. And so, before Pulse, what was your perception of PEMF in general?
I knew that it helped with mitochondrial function. Like that's kind of like what I had heard. It's like it helps with mitochondria, it helps with energy of the cells, and people feel less fatigue, and overall, I would say more like systemic wellness. That's kind of like my impression of like what I had, heard from other providers, that people just feel energy-wise better.
Mm-hmm.
And then I got a hold of it and started using it on the brain, and started using it in more of like a functional neurology aspect where, I might put it on somebody's right leg to drive their left cortex, or I might put it on the right cerebellum to drive and improve eye movement function.
So you're using it as an afferent stimulus to provide an efferent reaction or response.
Yeah. So we're using it more of like neural modulation to drive brain function. So, we might use it to improve somebody's velocity of their fast eye movements. So I have some information and some data where, we actually do it on the frontal cortex, and we can speed up the velocity of how fast people's eyes go. So one of the guys that I work with on the Vikings 2 seasons ago, we did that almost before every single game. So we would do transcranial PEMF. We would do it on the feet just to like afferentate the nervous system. And you would see, you just do it on the feet. Next thing you know, people's hamstrings are looser. So you don't actually have to use it just directly on a certain area to overall improve function. You get it on the body, you could do it on the hand, and you can improve function of the brain just from getting it on the body. So obviously there's a decrease in neuroinflammation, I would say. There's an increase in blood flow with using the device. They've actually shown that you can speed up red blood cell movement by 5.5% after doing it for 30 minutes over a 3-hour period. So you can take those small arterioles, those small vessels, and you vasodilate them, and that works with nitric oxide physiology. So if you're talking about having a practice that you want to improve headaches, migraine, dizziness, vestibular migraine, patients with overall depression and fatigue, we've seen so many improvements with people that feel depressed. Or what I see, the main improvements, I would say energy, gut feels better, way less fatigue, sleep for sure. And when you look at that, you go, man, that must be doing and working on some mechanisms with the lymphatic system and clearing out neuroinflammatory debris from the brain.
Well, with everything you just mentioned, I'll just like to say, sign me up.
Yeah. So, you could just use it in so many ways. So I'll just give you an example. Somebody's here for 5 days. They're doing our neurointensive program. After we get all the diagnostics and everything done on the first day, say they come in the next day and they're fatigued. We might wake up their nervous system with getting them on the PEMF. So it allows us to be able to do all of the other therapies that we're doing. We also use PEMF to localize where injuries are. So when you put somebody on the mat, they might say, man, I really feel this in my left shoulder. It's actually localizing into my jaw. So then you can get more specific with your manual therapy and use PEMF as a localization to find a source of injury. So we'll see that all the time. Somebody's like, man, I didn't even know my right SI joint hurt. I had an injury to my right SI joint when I was 15. And you put me on the PEMF, we're doing full body, and now it's localizing right there. And I go, that's probably a source of injury. Let's go in there, look at the biomechanics, And then why don't we start doing, either more PMF on it, do low level light therapy on it, or, other modalities. We like to stack things on top of it. So
Very good.
yeah.
Yes, that's awesome. So, like, let's take us through a typical patient visit, before treatment, during treatment, after treatment, and then also speak to the chiropractors that may not have the neurological training that you do, the neural training,
Yeah.
but how this device could positively influence their chiropractic treatment for the general chiropractor, how that might impact
Sure.
their patient results and that type of thing.
Yeah, so say if somebody was coming in, they're a local patient from Minnesota, and they're coming in for our 45 or 60-minute session. They're not doing an intensive program. They'll come in. I always check everybody out neurologically. It's just a baseline screen. It takes me 3 minutes, and I'll watch them walk, and I'll just look at their finger to nose. I'll take a look at their eye movements, and I might say, your quick eye movements are looking a little sluggish today, or your balance is a little bit off. And based off of my findings, kind of compared with my structural palpation and stuff, we'll start to go in and say, these are the therapies that we're going to do over this next hour. It's going to include PEMF. It looks like your right side of your body was a little uncoordinated. We're going to start off putting the PEMF with a cube while you're laying on the full bed underneath your right leg. We're going to do that for 5 minutes, and we're going to affrontate your system. And then we're going to move up and we're going to do it on the cervical spine. We like to wedge the cube, get that going on the cervical spine. And one of the things that I found out is when people are really sensitized, less stimulation seems to be more. It's not always about more activation and like really cranking up the device. But people are, they could have central sensitization, peripheral sensitization. Less is more. You're trying to affrontate the system. You're trying to get better blood flow. So we might put them on there for about 10 minutes or so, get their nervous system doing well, and then do their adjustments, like get things woken up and then adjust them. It seems to last longer and things seem to be more stabilized afterwards. And then we'll usually move into doing some neurovisual or vestibular training. So we might be doing some eye exercises or do some balance work, or get them in the gyrostim chair, work on some like combination head-eye tracking. And if they're fatigued at the end of the visit, then we might put them back on the PEMF and then stack that with molecular hydrogen while we do some low-level laser and maybe do some like body movements and do some myofascial work. Wow. So that's what kind of like what an hour session would look like. And then if we're trying to get more specific neurologically, we might take some of the accessory pieces of the PEMF and place that on the right cerebellum or actually get it on the left cortex. So based off of our neuro exam, we might stack it in certain ways. And we might even be doing like different body movements with the person, like a complex movement with their arm or their leg, or I might go adjust an extremity to drive their brain in a certain way. I mean, a lot of people have taken the functional neurology courses, so it's a great way for your general chiropractor, your sports chiropractor to add some neurological stimulation into your visit. So even if you don't know everything that there is about, the cerebellum and the basal ganglia and all this stuff, and nor do you want to know it, you can use it to basically stack and drive the brain and improve function. You just have to make sure that you're not overstimulating the person. How would you know if you're overstimulating somebody? They might feel lightheaded or dizzy. And you can do that with people on the PEMF. I mean, if you did overstimulate them, or if somebody, here's another really easy diagnostic tool. You do the PEMF, the person feels horrible afterwards. There's probably something metabolic going on with that individual where they detox too fast, or maybe they had some sort of candida infection. So in that way, clinically, it also lets you know if maybe there's something metabolic going on with the person as well.
Great point.
Yeah.
No, that's a great point. So, essentially, what kinds of patients do you find that respond the best to it? Is it acute injuries, chronic pain, neurological, or, even post-surgical patients? What kind of patients seems to respond the best? And how do you identify those patients that have the greatest need for using it, would you say?
Yeah. I mean, for sure, acute injuries. I mean, I can just tell you personally, I tore my supraspinatus tendon, a violent injury with my dog ripping my shoulder and tearing that without having surgery, used PEMF, dry needling. It was like 90% torn. PEMF, dry needling, myofascial work, laser, microcurrent. But I would say overall, PEMF was like a huge improvement in my shoulder function. And that's, one of the reasons why I wanted to buy it. But, we'll see guys come in with AC separations or an ankle sprain. And from an acute injury standpoint, it's very helpful. Our practice, I would say for the most part, is more of your chronic types of patients. So people that have POTS and dysautonomia. If you want to talk about improving blood flow, it's a great way to improve blood flow and get better perfusion and oxygenation into muscle tissue. So it helps with chronic pain and just getting better blood flow up to the head. And I can tell you, there's a lot of people that are walking around that are going into chiropractic clinics that have low-grade autonomic dysregulation. And then when they get adjusted, it stimulates their nervous system and it helps their autonomic function. So I think coupling chiropractic manual therapy with PEMF is a great idea, because you're improving so many mechanisms without you don't even have to know everything about all of the stuff about PEMF either. All right. Yeah. If you're somebody, you're like, all right, I want to use this stuff, but I don't want to know every single thing that there is about, gauss and, frequency and like, what kind of wave is it? Is it a square wave or this? Like, you don't have to know everything about it. It's going to help. That's clinically what we've seen. So it's for sure people that are fatigued, people with chronic fatigue. And think about people and athletes and how much they're performing and how much fatigue they have like during the season from just overdoing everything. So you'll see that a lot. Like during the summer, guys come in, they're playing in the beauty league here in Minneapolis area, and they might do some myofascial work with somebody else, come in to see me, hop on the PEMF, and then do some neurovisual training, and then they go skate. So that's a pretty common thing where they'll see me to do a little bit of the neuro and some more specific adjustments for the brain. They usually have a good sports chiropractor that they're also working with in addition to me. Most of the players also have a myofascial person that they're working with, usually massage therapist. And then I'm kind of doing the neural piece. So I coordinate with everybody to make sure we're all on the same page too.
That's great. And I know as a chiropractor, I've had this happen. I'm sure many of those watching have as well. You have those patients that seem to plateau. They just hit a spot and they don't get better beyond a certain level. Have you had particular cases where you've seen those patients, again, take off and be able to improve? You've seen somebody who's had a certain amount of chiropractic care, they've had great benefit, but they're just kind of stuck or plateaued?
100%, because if you look at overall, like how does the brain know where your body is in space? It's multisensory integration of visual, vestibular, proprioceptive function. So say if they're only getting adjusted, and nothing against that, but say if somebody's not doing myofascial work or they're not working on the brain and their adjustments aren't holding, or the person has spinal instability and the person just doesn't know where their body is in space, I look at PEMF as a great way to affrontate the nervous system to build maps of the body. So a lot of times, like we'll use the idea, and we learned this from Professor Carrick, of sensory before motor. Let people know where their body is in space before you actually go to do these motor tasks. So say if you're trying to do some sort of glute activation or drive hamstring function or wake up the VMO or drive some sort of core stability training, and you're doing these exercises, maybe the person just doesn't have a good idea of representation of where their body is in space. And I think that's, from a neurological standpoint, that's really where PEMF can come in. And that's that kind of neuromodulation aspect of just driving the cerebellum with it. You're activating all these pathways that are going up through the spinal cord, and you're actually just driving cerebellar function. You're activating that cerebellum, and that's feed forwarding into the brainstem up into the cortex, and literally just driving neuronal function. It's activating BDNF, brain-derived neurotropic factor. It's building plasticity. It's getting better blood flow up to the head. It is helping with neuroinflammation. There's research on PEMF where you drive it into the brain with magnetic stimulation. You can actually modulate the brain's immune system. So when you look at a majority of the issues that people have, like fatigue, depression, anxiety, those are disorders of neuroinflammation. So if you want to help a ton of people in your practice, like get PEMF on their body. And I would say a lot of people come in to see us, eventually will end up buying a PEMF, not a high frequency PEMF, but more of like low frequency. They'll use other companies, and then they're kind of stacking it. They'll come in here and they'll do, higher frequency PEMF. And then at home, they'll have another unit that's usually, pretty affordable at home unit. And they're using it, pretty frequently. And I would say like the combination of that, people feel so much better. Like energy's better, sleep is better, mood. I mean, I would say like mood, sleep, appetite, major improvements. So if you're a general chiro and you want to help a lot of things without taking every sports chiropractic class and every manipulation class and every myofascial technique and ART and all the amazing things that we do, it's a great tool.
What about like with your hockey athletes? I mean, obviously there's major therapeutic benefit and, as you said, neurological benefit and everything. But what about for not just recovery but performance preparation, even maintenance? You know, those types of things. I mean, is there a protocol you can use with your athletes that that will help kind of keep them finely tuned, even between their activities and between their injuries, that type of thing?
Yeah, I mean, 100%. I mean, I have a pretty core group of NHL guys that all summer long are in here, yeah, doing training with me, but then also just doing PMF as a recovery tool. So, I mean, you could definitely use it as just recovery. I mean, if they have a, pretty hard skate or they're really pushing it with their training, it's a great way. And I mean, a lot of these guys, here's another thing to consider. They're playing a lot of golf, so they're doing a lot of golf. I think it helps with their game. I've seen that. People feel better. They feel crisper. And a lot of them have young kids. So they're not getting the best sleep. They're busy. They're going to tons of weddings and they're trying to perform. So there's all of these like life things that people don't, also consider. And I would say if you're just feeling wiped out and you're feeling fatigued, adding it in with your athletes, they definitely feel, more energy and sleep, like 100%.
What about like travel? You know, I've seen over the years working with athletes how travel, especially cross country travel, things like that, really just wipe them out. So they get back from a road trip and everything. Is there a protocol that you would use for this, for that kind of like jet lag and just fatigue from time zone changes and lack of sleep, flying throughout the night and that type of thing?
Yeah, I mean, I'm putting them on the PMF or something like that for at least 45 minutes to an hour. So we'll have them lay on the PMF. And initially, so I actually go in and I'll like rotate the frequencies that I'm using. I'll usually start off with, okay, let's try and chill your nervous system out. I'll do the frequency at like a 2 to 2.5. And then towards the end, if we want to just kind of wake things up, I might, put it at 5.5 and start to just drive it a little bit faster. Some patients, like you do too high of a frequency, they get anxiety. They're like, man, that's just too much for my nervous system. So depending on the kind of the state of where that person is, I might start off a little bit lower and then we'll start to increase it. And then I'll do a lot on the gut. So I like to do GI. People feel so much better when they do it on the gut, and just in terms of fatigue, and you're getting also vagal nerve activation. And then for sure, we're hitting the legs. I mean, we're doing on the legs on almost all hockey guys. So I'll like wedge it behind their hamstring. When you wedge it behind the hamstring, like you should see the quad activation that you get. So you don't actually have to put it directly like on the quad to drive the quad. You can put it on the hamstring and then drive it through. And then their legs just feel so much crisper. Like you just feel lighter. I would say you guys come in, they feel just kind of groggy and they come off and everything feels crisper and it feels lighter. And if you actually get some diagnostic data, you'll see that their quick eye movements and even like their pursuit eye movements, gaze stability looks way better just from doing PEMF, because it's activating the brain. So then we'll move it up, and then I'll normally go and I'll do like wedge on shoulder, take the larger pad, put it on and like hit the rib cage and just work on like respiration, work on breathing. So if you work on trying to open up that rib cage, guys feel a whole lot better just from like a balancing out, oxygenation, CO2 ratios. And then we'll normally go do cervical spine and then we'll do the brain. So we're not just letting him just lay on the mat like the whole time and just fall asleep. We're moving around to try and activate the brain differently.
Yeah, that's great. I mean, that was one of my next questions, of just areas of the body with hockey athletes, what areas you use it on and everything. You covered that really nicely.
I mean, hamstrings for sure. Like if you have a lot of hip and groin stuff going on, I would say it's very, very beneficial for hip and groin. We've had some pretty nasty hamstring injuries that we've improved. Neck whiplash all the way. I mean, cervical spine whiplash. Basically, when you get the cube up here high, you can literally feel it going into your kind of upper cervical. It feels like your ligaments feel more stable when you get done with it. And it feels like if you have a lot of brain fog going on and your head feels heavy, you come off and you're like, wow, I can really feel that I have better blood flow going up to my head. So one of the tools that we purchased, which Joe, I have to talk to you about this because I want to do a research study, but I have FNIRS, which is functional near infrared spectrography. Basically, think of it as like pulse oximetry for your brain. I want to do pre and post like blood flow analysis and actually see what's happening with, improved perfusion into the cortex.
Yeah.
And that the device that I have looks at temporal and frontal lobe.
Fantastic. Yeah, that would be
Like
great.
just from a clinical standpoint, like you'll see guys get off and they'll walk and go, all right, I feel more solid into the ground. My legs feel like they're more underneath me. So, I mean, it has to be working on neurotransmitter function, like driving improved norepinephrine, regulating cortisol levels for sure. Just with how many different types of things I've seen get better with people.
Yep.
And sometimes you'd just be surprised. It's like you adjust somebody and next thing you know, they have better bladder function. Or you adjust somebody and their whole breathing mechanics are better, but you didn't even adjust their ribs and you adjusted their upper cervical spine and you activated some neuronal networks that improve their brainstem function. So you'll see all sorts of things get better when you're doing PEMF that you wouldn't even think. And you're like, oh, wow, I didn't even think that was possible.
Yeah, I was going to ask you about that. Yeah, some of the things you maybe didn't even expect, for results with it. You're working on one thing, you're seeing results with something else. We've all seen that in chiropractic, right?
Yeah.
Because we're influencing the nervous system also, and so it's interesting. It's just another way of influencing the nervous system.
Yeah, and you might, have somebody that has dizziness and vertigo and balance issues, and you would think, well, maybe I should go do this on the cervical spine, but then you realize that, wow, you know what, this person's kind of unstable. And neurologically, they're unstable. Maybe less is more. Maybe I should go in the periphery. Maybe I take the rings and I just wrap it around their right arm and just pulse their right arm for 5 minutes and get that on the median nerve. And I basically just fire that activation up into the brain and you see improvements happen. So that's kind of like the neuromodulation aspect of how we use it.
Very cool. Very cool. So if you were speaking to a chiropractor working, let's say with collegiate or professional hockey players who's never used Pulse, what would you want them to understand about it?
Yeah. So obviously it helps with injuries, acute injuries. We've seen improvements from that structural standpoint, but I would say think about it from also the overall general neurological wellness, performance, and recovery aspect. Like if you want to recover up an athlete so they can go do more, it's a great tool to have. And I would say you could probably prevent athletes from just overall overtraining syndrome and getting burned out because you are working on the autonomic nervous system. And for sure, PEMF is working on autonomics and improving integrity of that. So if you want to kind of stabilize sympathetic, parasympathetic balance, I would say it's a great tool. Let's not forget that a lot of athletes also have anxiety and depression, right? That's a lot of people are also working with performance psychologists and other things of that nature. Just because you're an athlete doesn't mean you're, immune to having these problems with, there's all sorts of things that could be going on with your athletes, ranging from marital stuff and stress and trauma, family things. So I would say it's a great tool to help brain function. So overall, just help brain function, help mood, help stress and anxiety to allow them to be able to go in and keep doing the things that they love to do.
No, that's fantastic. I know we're starting to run short on time. Got a couple more things I kind of want to ask you and pick your brain about. So, what would you say is one of the mistakes maybe clinicians make when they're evaluating new technologies initially? Because this may be very new for some people. What would you say would be something to be aware of that you have to sort of open your mind to or work through, when you're evaluating new technologies like this?
Yeah, for sure. I mean, honestly, I would say everybody's going to look at cost right away, right? So, you're looking at cost, but then you have to look at, I'm not trying to just straight up sell this device, but I've had zero problems with the device since I bought it in, what was it, Joe, like 2019?
Yeah, it was at least 5 years for sure.
Yeah, so it's at least 5 years. And then I ended up buying another device as well because we were using it so much. So, obviously make sure that the cost is comfortable for what you're looking for. And that's one of the main things. But obviously there's all sorts of payment plans and things that you can have. And if you're using it on a lot of people, you're just going to make the money back. You're You're going to make the money back, and the way that I look at technology is I look for things that are going to fix problems in patients that I see that are struggling. So if you have a variety of people and you keep saying like the same problem come up over and over again, and people are coming in your practice and they're like, man, I have all these GI problems. Oh, I have all this anxiety and this depression. And you go, well, I'm so limited with what I do. I don't know if I can help those problems. I'm going to look for a piece of technology that can help those problems in a lot of people. And that's how I've been able to scale my practice into, one of the largest functional neurology clinics in the world is, basically buying technologies that make sense to help a lot of people that I consistently saw coming in with a certain problem.
Yep.
Right. That's basically it.
And if I could add something there too, that's a great point. But when you talk about scale too, across a patient base, I think that people should look for technologies that combine and complement and even support or enhance other approaches or techs that you're using. So earlier, I think you mentioned the fact that an adjustment might go easier, or I think you said last longer. And so if we can stack a technology or a modality that helps other things you're using, that's just another way of helping to scale, that efficacy across the patient base, I would think.
Yeah.
And then there drive referrals too. I mean,
you're 100% you're going to drive referrals. Like people are going to go, that was awesome. Like I felt so much better with that. And then once they show that, it helps their family or that maybe their energy levels are better, like you got to think about all of those things. It's like these guys are fatigued from doing everything that they're doing. And then they got young kids and then they need to be like cognitively there to be able to do all the things that they need to do. It's a great tool to just improve overall life function. And it's going to help your golf game too. So
I got 30 extra yards.
Yeah. I got one last question I'd love to ask. Yeah. And is there a particular case that you'll never forget? Like one that just blew you out of the water? I mean, obviously with HIPAA and everything, you probably got to keep your privacy. But I mean, is there one case that just really stands out that was just one of those quote unquote miracle cases that you'll never forget?
Yeah, I mean, it was hands down. It was a craniocervical instability case. So it was like CCI where the person had received prolotherapy, PRP, doing all of like the spinal stability work, great care from NUCA Chiropractic. Like they were doing all the right things. And we just started doing PEMF like in the upper cervical. And then I actually just started doing it. Like I actually do it on the jaw a lot. So we'll do like a lot of TMJ feedback, trigeminal stimulation with it. And the combination of like activating that trigeminal and the upper cervical, I think it really stimulated, well, first of all, some areas of the brain, but I think it got better blood flow into those ligaments to allow those ligaments to actually, stabilize and heal. So we're doing some really cool things with craniocervical instability and CCI with our patients with PEMF. And then we'll usually kind of stack that with laser. I use zirconia. So then I have like the GVL, EVRL, and we'll do stuff like stack PMF. And then I'll actually shoot laser at the back of the throat, try to get the ligaments there, and then get anterior, and then occipital. So seeing some very amazing improvements with people with very unstable cervical spines.
Very cool.
Yeah, the person that comes to mind he was a hockey player and got absolutely crushed into the boards. Literally, he could barely even go like this, and he was going to puke. So,
wow.
Yeah. So we have stories and stories like every single day. I was just telling Joe, I was working on a hockey guy earlier today, and he legit has a 10 out of 10 headache. It's just the worst headache imaginable. And we put him on the PMF and it drops to like a 3 within 10 minutes. Wow. So then you got to go, what's that? Like, what is that mechanism? Because I did full body. Like I just had it laying on full body. So you go, systemic, full body. And then you have to go, wow, is there anything metabolic going on with this person? He has this headache. And then you have to think about other things. Like what are other things that can get triggered from traumatic brain injuries? Chronic infections, viral load, maybe the guy has some sort of tick-borne co-infection, Bartonella babesia or Lichia, or like something got reactivated. These co-infections actually take vasculature and they just vasoconstrict vasculature. So you get decreased perfusion. And his feet were purple. So his feet were purple and we put him on the PEMF. And then when we stood him up afterwards, you saw the change in the coloration of his feet. and then his headache was way less. So headache wasn't just less from laying on his back. I mean, it was less over like a 30-minute period after doing the PEMF for, I think we kept him on there for about 20 minutes. So, you know, that's another thing that I would say, systemic effects. Like there has to be systemic effects that are happening in the body physiologically with lymphatic system, changes probably in glymphatic system with clearing of inflammatory mediators in the brain, modulating cytokines and changes in like Th1 and Th2 balance in the body. I know that you guys did a study with, how do you say the device that you guys use to look at cardiometabolic function again? Is it the Pinoe?
The Pinoe?
Yeah, Pinoe. Yeah. So improving cardiometabolic function. Like we see people that can literally breathe easier after doing the PEMF with full body. So imagine if you did PEMF and then you went and played. You know?
Yeah.
Sure. Yeah.
Like, oh, that's fantastic. I mean, I know for me, I know we've talked about this, Doc, about having you come speak at one of our events. You know, so I would just say to you viewers, you know, if you like the kinds of things that Dr. Schmoe was talking about here, you want to be able to integrate them in your practice, keep your eye on our website. That's probaseballchiros.com or prohockeychiros.com. We're definitely going to have him out as a presenter here coming up in one of our upcoming workshops. And so
awesome.
Would love to do that. I've just learned so much already, and can't wait to pick your brain on some more things.
Yeah, we'll keep it going. And I need to learn more from you too.
Yeah, and if
you were the sports chiropractor for is it the Coyotes and then also the Diamondbacks, right?
Yeah. I'm just an old guy. I've been around forever, so I don't know what I could teach you, but
yeah, I'm sure you have a lot. And you went to Northwestern too.
It was a blessing. I was a Northwestern grad, yeah. So we got that going for us.
Yeah.
Awesome.
Yeah.
Well, I want to thank both of you guys. This, I think, was phenomenal. I think people are really going to enjoy this and get some great information out of it. Dr. Allen, I appreciate your time today, sort of being the moderator and the interviewer. And I think you asked awesome questions, and I'm looking forward to seeing you guys, you and your team up in Bloomington. And Dr. Schmoe, people want to learn.
Anyone that's in the area, you want to come on out. It's open to all chiropractors and students, and the information is on our website. So we'd love to have you guys join us.
Fantastic. And we'll put this down too with the video here too. We'll try to include the link if we can. And then Dr. Schmoe, if people want to learn more about the Functional Neurology Center, they just go to your website maybe and inquire.
Yep. Yeah. So it's thefnc.com. So they can go check that out. And I also have our other programs called the Hockey Brain Center. So we have the FNC, which is more of our kind of like complex traumatic brain injury, severe cases. And then we have the Hockey Brain Center, which is kind of more focused on more sports concussion prevention. Like I think that we can actually do things to prevent concussion with improving education, but also spatial awareness. So improving everybody's eye movements, their whole vestibular system and body awareness to prevent getting hit. Obviously, you can't prevent every, injury that there is, but I think you can definitely decrease the risk. And then having good objective data. So, using neck care to get information on neck range of motion, joint position sense. I've used their butterfly test. That's a really cool piece of technology that I think all sports chiropractors should look at. So it's called Neck Care. It's from Iceland.
Neck Care will be one of our sponsors at our event. Yeah.
It's just such a great tool. So yeah, we're just trying to, being where we're at in Minnetonka, we just want to make sure that no kids are left behind with lingering sports concussion symptoms that are going to keep them from being able to do what they love to do.
And of course, Joe, you're going to be there, so they can come out and check out the Pulse PEMF.
For sure. We'd love to see as many people as possible demonstrate the technology. You're going to love it. If anyone watches this and wants more information, wants to get a hold of me with some questions about Pulse, I can be reached either on Instagram, just search PEMF Joe, and you'll find me, or J Lehotay, Lehotay at pulsepemf.com. And, entertain conversations and help you out however we can, get you a demonstration, some pricing, whatever you might need. But guys, I appreciate your time today. Loved hanging out with you guys for a half an hour. I think it's going to be really valuable for people to watch. And we will see you guys on the next episode of Resilient Business.